Hi, everyone. Thanks for joining our third installment of the webinar dedicated to transition to adult care from pediatric to adult care for our CHOP transplant recipients. As I said, this is session number 3. Hope some of you are able to make 1 and 2, and we're looking forward to a really great session tonight. So my name is John Savon. I'm a physician assistant with the CHOP kidney transplant team. And session number 1 highlighted transition readiness. Session number 2 garnered psychology and social work perspective. And tonight's session is going to be on pharmacy and adolescent medicine perspectives on transition to adult care. A couple of housekeeping issues before I introduce our speakers for tonight. The videos will be recorded today, but nothing about participants or attendees will be in that. It's just going to be the speakers and the PowerPoint slides. And feel free, we want this to be interactive. So on the right side of your screen, there's a Q&A button. Feel free to hit that at any time to provide feedback, post questions. We want to benefit from our experts here, so feel free to ask anything. Your name will come up when you post a question, but that won't be recorded in the video. Videos will be available at the end of the whole webinar series. And speaking of which, again, this is session number 3. Session number 4 is next month on July 8th. And that's going to be an exciting one, too, with discussion with adult transplant providers, giving their perspective, and also about patients that have gone through the transition process to give their perspective about issues, roadblocks, pearls of wisdom regarding the actual transfer process. As we know, transition is a process and it's not an event. Transfer is the event. And that's, if you haven't registered for that already, it's the same registration link, and we welcome you to come to that one as well. Right. So during this Blue Jeans event, attendees' mics and videos are muted. So we're just going to have the presenters. And as I mentioned, the Q&A feature, please use that liberally. We want this to be exciting and engaging. And after today's session, you'll receive a link to a survey. We encourage you to complete that brief survey. It's just a handful of questions, but it helps with our program development to get what you all thought about this session. All right, so let's get into it. We have a pharmacist, Jennifer Hewlett, today, who's going to start us off. Jen's a residency preceptor with the pharmacy residency program and a clinical pharmacy specialist in nephrology and solid organ transplant. And she's going to give us a talk on pharmacist perspectives on transition to adult care. Next, we'll have Dr. Sheila Quinn, who is an attending physician in the Craig Dulcimer Division of Adolescent Medicine and the Transition to Adult Care program at Children's Hospital of Philadelphia. Dr. Sheila Quinn is actually a DO. Sorry about the typo on the slide here. So thank you for joining us today to discuss pharmacy and adolescent medicine perspectives. And I will hand it off to Jennifer.
Hi, everyone. Thank you so much for joining us today. I am going to go ahead and share my screen and share my PowerPoint presentation that we're going to go over for today. Hopefully everyone can see my screen currently. Today, we are going to talk about knowing your medicine as well as knowing your pharmacist. So why is medicine so important after transplant? Phil, the pharmacist, says medicine helps to keep you and your transplant healthy. But what is medication adherence exactly? Well, medication adherence is actually the act of taking your medicine exactly as prescribed by your doctor. This sounds easy enough, right? We teach everyone it's important to remember to take your medicine the same time every day, never skip any doses, never take any doses late. Easy peasy, right? Well, what about 1 year after your transplant? 2 years, 5, 10 years? Can you honestly say that you always remember to take your medicine? Well, we understand that that can be hard, so it's important for us to provide you with strategies for improving your medication adherence. Looking at this, we will talk a little bit about using technology as well as apps, setting not one alarm, but 2 alarms, using a pill box, as well as tell us if you're ever having any trouble with remembering to take your medicine. Starting with the use of technology as well as apps. Nearly everyone has access to a smart device. In fact, a study from 2019 showed at least 88% of adolescents have access to at least one smart device. Since that study was published prior to COVID, I'm pretty confident in saying that that number may be quite a bit closer to 100% as of today. One of the key ways of improving medication adherence is using the tools that you or your child already have access to. One app that is commonly used is MedActionPlan. MedActionPlan is a free app that you can get through CHOP. This app will allow you to use an up-to-date medication list, and it can even be set up to send alerts or alarms when medications are due to be taken. iPhones and Android devices also are able to be set up with the Health app. You may need to update this app on your own, but healthcare workers and frontline responders are taught to check for this app. You can include that you're a transplant patient, as well as a list of your current medications, at least the names. It may not always have your up-to-date doses. But you can also include your allergies as well as your emergency contacts. Setting alarms and setting a backup alarm is really important. I know I'm a big snoozer, so even though I set my alarm for, say, 6:30 in the morning, I'm probably going to hit snooze a few times. So by setting that first alarm, that's kind of your warning, but your second alarm is your, hey, no, now it's really time to go ahead and take your medicine. Pill boxes are also super helpful to keep you organized and really come in quite handy. And you know what? Taking your medicine over time probably feels a bit like Groundhog Day. Now, I don't know if all of you remember this movie because it came out in 1993 and some of you may not have even been born yet. So let me just set the groundwork for this. See the main character in this picture here? He kept waking up every day and repeating the same day over and over and over again. Does this sound familiar with your medicine? Probably does a little bit, and pill boxes come in super handy. Again, they help to keep you organized so you don't have to remember what medicine did I pull from which pill box, which pill bottle, never remember, was I supposed to take 1 or 2, how many did I swallow already? But it also helps to remind you when it's time to go ahead and get a refill. If you can't fill your pill box for that entire week, then you don't have a 7-day supply. And it's probably about time to go ahead and call the pharmacy to go ahead and get another refill. Even better, if you fill your pill box once a week, you can set it in a spot close to your bed, maybe with a bottle of water or Gatorade. So you can roll over, take your medicine, and go right back to sleep. So it really doesn't interfere with your sleep all that much. But make sure that you at least sit up when you take your medicines. I don't want to hear that you had any choking hazards. Also, we need you to tell us if you're having trouble remembering to take your medicine. Unfortunately, we're not mind readers. We may know you're having a little bit of trouble, but we may not know that everyone's having trouble with remembering to take your medicine. So we're a team. We need you to talk to us. We will find other strategies that are here and ready to help if you need help with taking your medicine. So why is remembering to take your medicine so hard? Remember, this can unfortunately be a daunting task sometimes after you receive a transplant, and frankly, life can sometimes get in the way. You have sports, you have band practice, you have school, you have work, you have college life, or frankly, life in general. Sometimes it's difficult to remember what dose we changed, what dose we wanted you to keep taking. That can also mess with the way that you remember to take your medicine. Also, medication expense can sometimes prevent patients from being able to pick up medicines from the pharmacy, or as they may be unable to pay for the copays, and that will limit your access to medicines as well. What I'm going to do next is break down some of these top reasons for forgetting to take your medicine and provide you with additional strategies in order to help transition you into some independence. So let's start with life in general. I do always say that sleep is key to my happiness, so sleep is very important to everyone. And, we get busy. Like I said, sports, practice, work, college life, or just life in general. Being active and having a job, taking your medicine at, let's say, 7 a.m. and 7 p.m., that may have worked for high school, but is that going to work for college? Or maybe you have a job and you have to be at work by 6 o'clock in the morning and you don't want to keep your medicine in your pocket because what if it falls out or if you get busy at work and you forget to take it? Maybe this is time for us to talk. Maybe this is time for us to talk about ways that we can change our medicine schedule around so it fits in better with your new life and your new schedule. For the example of starting work and having to be there at 6 o'clock, maybe a better time for you might be 5 o'clock in the morning and 5 o'clock at night. Or let's say this is your first year of college, and I was always an afternoon kind of gal when it came to taking my classes, so maybe I didn't want to take that 8 o'clock in the morning class. Maybe my first class started at 11 o'clock. So maybe a schedule of 10:30 in the morning and 10:30 might work out a little bit better for you, whereas maybe your friend, maybe they work better at that 8 o'clock and 8 o'clock schedule as well. The key is we will work with you. We will help you adjust your schedule while making sure that we're still able to check all your blood work and your labs just like we did before, albeit it may be at a different time. Just remember though, when we make these adjustments, this is a 7-day-a-week adjustment. This is not just a Monday through Friday adjustment. You will still need to wake up earlier on the weekends or even on your days off. So it's important to stick to the schedule that we agree on. What about forgetting? Well, let's kind of talk about short-term memory loss. I can definitely be guilty of this from time to time. How many times have you put something down in a really good spot? You know that you're going to put something in a specific drawer and you're going to go right back to it and you're going to remember. Usually it's that thing that you never want to forget about. Well, let's talk about a real-life example when you're taking your medicine. Now you're an adult. You have grocery shopping. You have gas that you have to get. You have to stop by the pharmacy. We call you on the day of your appointment, say 4 o'clock in the afternoon, and we say, hey, Jimmy, your tacrolimus level is a bit too high today. We want to take your dose from 5 milligrams to 4 milligrams starting tonight, and we'll call you next week and we'll get some more blood work. But meanwhile, while we're calling you, you're at the grocery store, you can't find your wallet, it's somewhere in your pocket or your purse, you swear that you have it, you're looking all around and you're freaking out, and you say, okay, sounds good, and you hang up the phone with us. You leave the grocery store after finally finding your wallet, which happened to be in your back pocket the entire time. You've raced to the gas station, you fill up your tank, and you go ahead and you go home, eat dinner, and you take your medicine. All the time forgetting that we said, hey, let's go from 5 milligrams to 4 milligrams. The next morning you wake up and again, take your 5 milligram dose. Only to realize right after that, oh, we received a call from our transplant team and we needed to make an adjustment. It sounds funny, but I promise you, life will get that chaotic and this may happen. So what tools and what tactics can we use in order to prevent this from happening? Well, when we call you to tell you what dose you're taking or what adjustments we're making, repeat it back to us. That's one way that you can help remember that we adjusted your dose. If you can, make a note in your phone or write it down somewhere so that you have another place that you can look at again to confirm what your dose will be. And lastly, you can ask us to go ahead and confirm it with you as well. We can send you a MyChop message or even send you an email so that you can go home and you can look at it again later so that you have that extra reference. Remember, it's always okay to ask us for help. We're here for you and we are here to support you, both now and while we're transitioning out to a different place. Another reason sometimes cited for missing doses is cost. Medicines after transplant can get very expensive. Some medicines may be covered at 100%, while others may have significant copays. Insurance benefits generally change yearly, and this can change even if you stick with the same plan year after year. Changes to insurance can impact how much you need to pay for your prescriptions, and you may go from having zero cost to $1, sometimes even $50 for a prescription. And over time, this cost can add up quickly when taking multiple medicines. It's really important to understand your insurance as well as your insurance coverage. In order to kind of get ready, what we do ask is you can talk to our great social work team, you can speak to myself, even your pharmacist at your local pharmacy may be able to help say or provide you with information to make sure that you select the best insurance plan that works for you. Alternatively, if some medicines are not covered, we may be able to help you with patient assistance programs. Again, we ask that you reach out to the team to help sort through any of these insurance issues which may come up. Lastly, you may also have issues with just frankly getting your medicine. Let's say you move to out in with West Virginia or in the middle of the country where pharmacies may not be as easy to access, or you go away and no longer have a car or access to public transportation and you're living on campus. Maybe there's a shortage of a medicine and you can't get to the pharmacy, or they tell you, hey, we're really sorry, we have to order this medicine in, it's out of stock, and it'll be in about 4 days. But you look at your pill box and you only have one tablet left. What should you do? What we ask for you to do is always reach out to us if you're having any issues with getting medicines. If there's shortages of medicines, reach out to us because we may have alternative ones that will work just as well. Or we may be able to connect you to a pharmacy that has more ready access to that medicine. In some cases, I can set you up with pharmacies that can get you the medicine next day or within several days to make sure that you do not have any missed doses. What we also ask is maybe you can speak to your local pharmacist at your local pharmacy. Introduce yourself. Let them know if you feel comfortable that you are a transplant patient and you will be receiving your medicines being picked up monthly from them. Ask them if they commonly stock these medicines in their pharmacy. If they do not commonly stock them, it's okay to ask them, hey, I'm going to be a repeat customer. Why don't you stock these for me? I'll be here every month. And that way you can make sure that there are no limits to you being able to get your medicine. You can also ask them how quickly it will take for them to get medicine if they run out and if they're willing to give you a small supply until they receive the rest of the stock. These are just some ways that we can help improve access to your medicines. But let's go ahead and put everything together of what we talked about. So it's really important to realize that this is not an overnight process. We really have to put the pieces together and start slow. So maybe we move from setting reminders on our phones to then moving on to recognizing what medicines look like and combining that with the names of the medicines as well as the doses. You can fill your first pill box and maybe have someone look at it with you and make sure you filled it correctly. Learn about your pharmacy, learn about your pharmacist, and make sure that they have ready access to your medicines. You can slowly start contacting your pharmacy for refills, and you can do that over the phone, automated. You can do that by apps, or you can do it over the computer. And then we also recommend learning a little bit more about your insurance, navigating the insurance process. This could mean knowing what your copays are for each medication, knowing what a deductible is and what you need to reach. Will sending your medicine to a mail order pharmacy maybe save you money over time if you get a 3-month supply instead of a 1-month supply? And even which medicines may need a prior authorization completed by your doctor in order to get them. Anticipating what your needs are related to medicine will help to allow you to contact your team in an amount of time that can prevent you from running out or missing any medicine. Now, I know that I went through a lot of big insurance terms here, so I wanted to provide you with some references. And really, this was the way that I had to learn about my insurance as well. So what we have here is kind of a short review about some common insurance terms that you may hear a lot of people talk about. Remember, this is really just a short list, and it's just meant to kind of be a reference. So some things may be a little bit different for you. A common term you may hear a lot of people talk about is an insurance premium. What this is the amount that you pay for your insurance, but this will vary by plan. It's typically paid maybe bi-weekly with paychecks, sometimes monthly or yearly. Most folks will have an insurance premium that they have to pay. On top of the insurance premium, you also may have an insurance deductible to reach. An insurance deductible is the amount that you must pay at 100% of the cost of the service or the medication. And once you meet this deductible, your insurance will begin to share in the cost of your fees. This is often renewed every year as you renew with your insurance. A copay is the amount that you're responsible to pay for your medicine. This is what's known as a cost sharing with your insurance company. So an example of this would be going to the pharmacy to pick up a medicine like prednisone and picking it up and being told that maybe you have $1 to pay, but when you look on the receipt, it says that your insurance paid $4. So the total cost of your medicine was, say, $5. You paid $1, your insurance company paid the other $4. Now, it's not everything that you're paying out when it comes to insurance, because what we do have is something called an out-of-pocket maximum. This is generally the most you will pay for a covered service within a plan year, and this will renew every year, and the renewal date will vary depending on your insurance. So some folks will renew on January 1st. I know here at CHOP, we renew July 1st, and other plans may renew at other parts of the year. So all of these things, your premium, your deductible, and your copay will all reset at that period of time. Remember, after you meet that out-of-pocket maximum, your insurance will start to pay 100% of what you need. Lastly, something else that comes up quite often is something called a prior authorization, or a PA. A PA is an insurance plan requesting additional information to see if you are eligible to receive a medication or a procedure. Submitting the PA or prior authorization is not a guarantee that your insurance will cover a service or a medication, but it is a requirement, oftentimes for more expensive medications or procedures. There's lots of paperwork that has to go back and forth to get a PA approved, but you may hear sometimes that your pharmacist is waiting for the prior authorization approval, and that's what that means, the insurance company asking for additional information. Now, one way that you can work to save some money, if you are able, is to place some money aside in something called an FSA or an HSA. These are flexible spending accounts or health savings accounts that can be used to pay for copays, deductibles, and some healthcare costs. These accounts require you and or your employer to add money to the account, and the nice thing about it is that you're not paying taxes on it. So you kind of get a little bit of free money by putting a little bit of money aside. Now, that was a lot of information as it related to insurance, and insurance is certainly something that I will not pretend to have mastered, but over time have developed a pretty good sense about. But there's a really nice website that you can go to that will give you a lot of other things to consider, and that's www.healthcare.gov. And that will give you a glossary where you can look up other terms if you're curious about them. But it can also give you a lot of other additional information when it comes to learning a little bit more about your healthcare and your insurance. Thank you for tuning in today. And thank you for learning more about your medicine, learning more about your pharmacist. And of course, we want you to always talk to your team.
Great. Thanks so much, Jen. I'm going to bring up the slides for the next presentation. If Dr. Quinn, if you want to share your video while I bring up the slides, that would be great. And a reminder, we'll have a Q&A after the end of both sessions. Feel free to post comments or questions using the Q&A feature. Make sure that I'm muted. Hi, Dr. Quinn, are you on?
I am. Yes. Can you hear me?
Yes, we can. I'm going to bring up your slides right now.
Okay. Okay. I guess I can get started?
Yes, whenever you're ready.
Okay. So hello, everyone. I'm Dr. Quinn, Sheila Quinn. I am an adolescent medicine physician here at CHOP and an internal medicine physician at Penn. And I'm going to be spending the next 20 minutes talking about the overlap of what I do and transplant health, so the intersection of adolescent medicine and transplant health. If you didn't know that adolescent medicine was a thing, you are not alone. I get that question a lot, like what is adolescent medicine and what do you do and what do you do for my child or for my patient, etc. We'll spend a little bit of time talking about that tonight and what we are and how we may be able to help. So we'll cover areas like reproductive health, gender identity and sexuality, menstrual management, body image, eating disorders, substance use, and then at the end, there's a few, really useful websites and where you can find us if you do think that you or if you're a parent, if your child could benefit from any of the things we have to offer. Next slide. So our goal over the next 20 minutes is going to be to really, my goal is to underscore how very normal all of you are as a human, as a teenager, as a young adult. I would actually venture to say that you're quite extraordinary young adults, given what you have been through. And I also want to make space for the part of your health that may make these years a little bit different and at times more challenging than many of your friends or your family's experiences. And also want to think about how we can thrive through those challenges. So let's start with reproductive health. There are a couple terms that I want to just throw out there for you. One of which really relates to a lot of what Jen was just talking about, and that is something called teratogenicity. If something is a teratogen or if a medicine is called teratogenic, what it means is that a medicine can sometimes be dangerous to a fetus or an unborn baby. And so this means a couple things for patients who have received transplants. For most patients that have received transplants, they're on some sort of immunosuppressant for the rest of their lives. And some of those immunosuppressants are what we call teratogens, or they could be dangerous to unborn babies. It doesn't mean that that you can't be pregnant or that you can't have a child in your future if that's something that you want. But what it does mean is that pregnancies are usually best or safest and healthiest when they are planned with your care team. So letting your care team know when, you're thinking about having a baby, or when you think about, you and your partner want to have a baby, and how you want to go about doing that will be an important part of your care going forward, if that's something that you want. Who should you let know? Anyone, certainly like your transplant team, your primary care doctor, if you have a good relationship with them. Certainly if you already see adolescent medicine, or if you want to establish with us to talk about it, that's fine. Or an OBGYN, if you're potentially already established with an OBGYN outside of here. And definitely your pharmacist, likely, that's linked with your transplant team. So that's one thing, is that, the planning of pregnancies becomes important. On the other hand, the prevention of pregnancies, if you don't want to be pregnant, may become important for you as well. Because even if you say, I don't want to have a baby right now, or I don't have a sexual partner right now, very often people can't anticipate when they will have a partner, a sexual partner, that could potentially lead to pregnancy. And so thinking about contraception, or the big fancy word for birth control, ahead of time can sometimes be really helpful. So there are lots and lots of options to prevent pregnancy that are really safe for all sorts of different patients, including patients with transplants. There are many options that are really easy to use, that are free or very low cost, that are reversible if you want to have kids down the line and won't affect your fertility down the line. It's a really common question that we get is, if I take birth control now, will I be able to have a baby later? And then even if you've been told that there are certain types of birth control that you cannot take because of medications or medical conditions, there are options for you. There are definitely options for you. So definitely something that you want to bring up to either your transplant team, primary care doctor, adolescent, GYNs, anyone that you really feel comfortable talking to about that sort of thing. The other thing that I just wanted to touch on, and by no means am I an expert or any of my adolescent colleagues, but genetic counseling is something that we often think about around this time as well. People get transplants for all sorts of different reasons, and you just want to make sure, ask your team if your medical condition will be passed on to your baby if you have a biological baby, and what that means for them or for you. And likewise, I'm not just talking about the patients that are going to be having babies, in female bodies, but also for males and their ability to pass on genetic diseases as well. Next slide. In terms of gender identity and sexuality, patients with transplants are human, just like the rest of us. And some of us express ourselves as a gender that is the same or different as the sex that we were assigned at birth. Some of us are attracted to people of the same sex or gender, or the opposite sex of gender, or everyone or no one. And gender and sexuality, you may think like, well, what does that have to do with anything that we're talking about? I'm talking about like my health and my transplant. Actually, there's a lot of impact on our health. In terms of the medicines that we take. Certainly if people are transitioning from one gender to another, oftentimes that involves medications. It can involve procedures. It can involve our mental health and physical health and the preventative care that we seek going forward as adults. What types of cancers do we screen for and everything like that. And it can also really affect how we seek care and who we feel safe with on our care team. For example, if somebody is always calling you by the wrong name or the wrong pronoun, it may not be someone that you really want to go to and talk about your tacrolimus with. So it can have a lot of influence in terms of our experience as patients. And so something that is I would encourage you to really bring to the forefront of your care if it's something that's active for you. And if it feels like something that you or your child, if you're a parent listening, wants help navigating or bringing to the forefront of care, we're definitely, in adolescent medicine, definitely available to meet with any youth and their families and talk through these issues. Menstrual health is another, I would say, common thing that we deal with in adolescent medicine. So anybody with female reproductive organs, whether you identify as, male, female, etc. So anyone with uterus, ovaries, vagina, intact pituitary glands in your brain will eventually start menstruating. And periods can be altered by many, many, many things. So, for example, people that are under extreme stress, whether that's, social stress, work stress, medical stress, can have alterations in their periods. People with really intense illness, like a hospitalization, you yourself, family members, friends, etc., who have experienced chemo or radiation may experience times where their periods are either absent or different. Dialysis can cause irregularities with periods or potentially periods that go away for a while. And then nutritional status and weight loss can also be another really big influencer of periods. So there's a lot of different reasons that people can have alterations in their periods. And a lot of these overlap with medical conditions that patients with transplant experience. And so it will be important to know, in addition to just, my period's irregular, to some of the reasons that might be contributing to that. It also may be important for if and when you are looking to become pregnant. Certainly periods go away when you're pregnant. However, if you're also experiencing some of these other medical conditions at the same time, it can be confusing as to why your period is gone, what that means for your overall health, what it means for hormone levels in your body, bone health, which I know is something that a lot of transplant patients think a lot about. So, periods can be regular. They can come every month. They can come every 3 to 7 days, and they can not be that uncomfortable. And they can also be terrible. They can be really long. They can be really heavy. They can be really painful. And that can really, really stink. And I think the most important takeaway point is not to go through all the different reasons that can happen, but to know that that can be really terrible, and we're here to help you. There are definitely things that we can do to help treat painful periods, heavy periods, long periods, no periods. The medications that we use to treat can be things like hormonal medications like birth control, or there's also non-hormonal medication options if you don't want hormonal medications or can't have hormonal medications for whatever reason. That process is going to be really, the picking of medications to help manage any symptoms that come along with periods is going to be something that is a shared decision, not just between the patient and the doctor that you're talking about that with, but also with transplant teams, pharmacists, things like that. I have a patient, for example, that I'm working with right now who doesn't have a transplant but another chronic condition, and I was just talking with her rheumatologist today saying like, oh, I would like to try this type of medication. What do you think? Would it be contraindicated, et cetera? So it's something that, we're all very used to talking about around this age of like teens and young adults. And it's something that we're all really more than happy to talk about and get you to a more comfortable place with. No reason for you to suffer in silence with any of this. In terms of body image and eating disorders, really, really much more common than we think across the board. So not even just talking about patients with transplants, but really just across adolescence and young adulthood in general. It is not what we used to think in terms of one sort of prototype of a person of like a higher socioeconomic white female disease that is, once diagnosed, goes on for a lifetime. They really happen to anybody, any sex, gender, body type, socioeconomic status, any type of, coexisting diseases and conditions. So if you're thinking that it can't happen to you, it can. And for parents listening, if you're thinking that it can't possibly be what's going on with your child, it could be. The great news is that they are, in addition to us finding out that they are much more common and much more ubiquitous than we thought, we also have learned a great deal about treatment and prognosis, and we know that they're really, really treatable and really, really curable for the vast majority of them. Now, why are we talking about this now in the middle of an adolescent medicine and transplant talk? For a couple of reasons. One is because it's really common and you guys are, normal teens and young adults. And the other thing is that some things like medications and surgeries and procedures that may be more frequent in your lives than people who don't have transplants can affect how our bodies look. It doesn't necessarily mean that it affects it in a good way or a bad way. It just is the way our bodies are and how they endure amazing and really hard things. So there may be certain medications that make you gain weight, lose weight, make your skin look a certain way. There may be certain procedures that leave scars or no scars at all, that have trouble healing or require, higher nutritional needs while you're healing from a surgery, things like that. So many of the things that patients with transplants experience may alter their body in a way that sort of gets them thinking about their body in a way that they hadn't previously. I can tell you that it's not good or it's not bad, and it's just the way we are. But there are going to be times when our brains challenge that rationality, and there are going to be times when our brains fight that acceptance of what our body is and what it is capable of doing. But as I was saying earlier, really the wonderful thing is the quicker that we catch this and the quicker that we interrupt that thought process of, whatever that behavior is, whether it is dieting or exercising too much or purging by taking laxatives, or making yourself throw up or anything, the sooner and the quicker that we sort of interrupt that behavior, the better chance we have for total recovery and getting back to normal life. I know that patients with transplants spend probably way more time at doctor's appointments in the hospital than they would like. And so our goal is always, as much as we love seeing you, our goal is to always get you out of the hospital and out of the clinics for as long as possible and as healthy as possible. So we have an eating disorder program within the House of Adolescent Medicine here, and that has inpatient and outpatient components depending on where you or your child is at any point of this disorder, and a multidisciplinary approach like you guys are really used to that involves physicians and nurse practitioners and psychologists and dietitians and things like that. So it's part of what we do, and it's like I said, as common as it has become, we also are really grateful to have a really great base of evidence for treatment and cure at this point too. Substance use is something else that we are seeing increasingly more in the Division of Adolescent Medicine at CHOP, and this runs the gamut from anything from tobacco, marijuana, alcohol to heavier substance use with things like opiates, OxyContin, heroin, etc. More so in recent years with the opiate epidemic that we've been experiencing. The most important things to say about substance use is that, I think the most important thing is to be honest with your practitioner. Nobody is going to, handcuff you and take you out of the office for telling them that you smoke cigarettes or marijuana, but they are going to want to just make sure that the interactions with your current medications that are protecting you and your transplant are not in jeopardy because of the substances that you're using. They're also going to want to make sure that they're not putting you at any risk from either a health or social or psychological perspective. And they're just going to want to make sure that, these people are obviously have loved you and invested a lot of time in you, like your parents have and your families and friends have, and they care about you. And so they're going to want to make sure that, substances aren't getting in the way of what you ultimately want in your life goals. So in terms of, specifics around certain substances that can be dangerous for anyone, but I would say specifically to patients with transplants are, tobacco, I know you have all heard, causes lung cancer and chronic lung disease, and it can also really have some interactions with medications that can be lethal. It can be totally deadly for patients with certain medical conditions. So it can increase your chance of things like blood clots. So if you have a medical condition, for example, that makes you more prone to blood clots, or if you've had a blood clot in the past, smoking cigarettes can actually increase that risk even more. It can interact with certain medications, like I already was talking about birth control earlier, and it's another plug to remind you that if you are on any sort of birth control, it counts as a medication, and so make sure that your doctors and nurses and pharmacists are aware of that. Things like cigarette smoke and tobacco can increase the clot risk and cause some interactions with even things like birth control. Everyone is going to have, potentially different limits or, I guess, allowances in terms of alcohol intake, and it's so it's just really important to talk to your pharmacist and your care team about which medications are, are you able to take, I don't want to say with alcohol, but which ones can you, have a drink of alcohol on safely, and which ones are totally not a good idea, could make you super sick, things like that. And so just, asking your care team about which ones are safe to also have alcohol in your system at the same time will be a good idea, especially as you get older. If you're heading away from home for whatever reason, like for college, and you feel like you're going to be encountering alcohol at any gatherings, etc. If you're heading off to a new city or a work environment, like around the age that you start drinking or, soon thereafter, just really making sure that you know the answer to that question beforehand, because you may not have immediate access to your doctor or someone that would be able to coach you through that. In terms of marijuana, I know it seems like it is everywhere lately because it's in the news all the time, and it's being legalized left and right for medical and for recreational purposes. And so I don't want to deny that it is, and I'm sure that many of you have family members that have interacted with it in some way, shape, or form. It is seemingly everywhere. It is also a real risk in terms of interacting with certain meds that are really particular and specific to transplant health. So things like tacrolimus marijuana can interact with tacrolimus. So again, it really comes down to honesty with your care team, because if they don't know what's going on and they can't totally get like your TAC levels right or something like that, you may end up being on a lot more medicine or a lot different regimen than you really need if we could get to the root of the problem, which is really limiting or eliminating, marijuana use, for example. And then, like I mentioned, there's been, obviously an opioid epidemic in recent years. Unfortunately, teens and young adults are not spared from that at all. It is, I would say, sort of like what I was saying with eating disorders, and there's been an unfortunate rise and, recognition that this can happen to anyone. Same with opiates. Also the good news, like I was saying with eating disorders, is that we have found some really great treatments. And they are not just in the adult hospitals, but also here at CHOP. So things like Suboxone, which can help treat opioid addiction. We have, many providers here at CHOP that can prescribe that and help coach you through that sort of thing. So, just to have that on your radar if, heaven forbid, that becomes part of your life or your child's life. And then, really a take-home message that I want to stress is that no matter what the challenge is, whether it is substance use, whether it's heavy periods, whether it's pregnancy or not wanting to get pregnant, whether it's an eating disorder, whether it's just really not knowing when to refill your medication, ask for help. We definitely stress a lot during this transition process. And I know that one of the previous or earlier seminars was on the transition to adulthood. You hear the mantra all the time that we want you to be independent, that we want you to be able to do things for yourself. And I'm sure that if you're a patient listening to this, you've heard it from your doctors and your parents. And I'm sure if you're a parent, you have expressed this to your children, that, we really want you to be independent. The reality is we also can't do everything for ourselves all the time. And in those times of need, we need to be able to ask for help. And so the act of not always being independent, but what we call interdependent, or being able to depend on others when we need help, and then also being able to do a lot of things for ourselves, etc., is just as important of a skill. The biggest thing I can stress is, knowing who your care team is and knowing how to get in touch with them. And that is likely going to shift and change for a lot of people as they're, transitioning to adult care. And I would say embrace it. That everyone's got an app and a portal now these days. And, in Jen's talk, she was talking about the high percentage of young people who have mobile devices and stuff. Get the app. If you like need help downloading the app, someone can help you do that. And I've helped many patients download the app and whatever. So know your care team, know how to get in touch with them. We've seen that is a positive and protective factor for people doing well in this transition period. Also, just take the time to identify one or two trusted adults in your life, whether that's your parents, a friend, a doctor, a nurse, social worker, a therapist, a teacher, someone that you can talk to when things are hard and who can help you when you need it. You don't need all the solutions to everything, but if you can identify one or two adults and know how to get in touch with your care team, you've got your safety net set up. In terms of resources and getting in touch, I'm realizing that I added a fourth website to this today, and I'm so sorry that I must have sent an earlier version of this, so I will verbally tell you. But at the top, there are 3 websites that I very often give to patients for clinical information about general teen and young adult health. I would say the first, actually all of them are really thorough too in terms of reproductive health and menstrual health. The fourth website that I wanted to share with you is the Center for Parent and Teen Communication, which is started by true experts in our field from CHOP. And the website is parentandteen.com. Very easy, parentandteen.com. And that one in particular is very, very broad reaching and gives you really, there's just, at this point, probably hundreds of articles on there, but short and digestible articles about like how to talk to your teen or how to talk to your parent about tough things, sex, drugs, shyness, how to, increase how to increase independence in a teen, just how to talk to each other. It's really hard sometimes to be able to like relate to your parent or for parents to relate to their kids and find the right words to say that don't hurt people and things like that. So parentandteen.com is that website. And then if any of the things that I talked about in the last 20 minutes or so sound like something that you or your child could benefit from, definitely reach out to us. All of the things that I talked about are offered through Adolescent Medicine at CHOP, and we're in a few different locations now. We have one on Market Street, and here in Philadelphia, we have one in King of Prussia and another one in Brandywine Valley. So hopefully that gets somewhere near your home. There are some telemedicine capabilities as well. So please reach out. That's our phone number there on the slide as well. So I will end there, and I think there's time for questions.
Fantastic. Thank you so much. That was great. Jen and Dr. Quinn, really appreciate your time and your expertise. We do have some time for questions. Several questions had been posed upon registration, and you actually addressed a majority of them already, so thank you for that. And I'm going to go through the Q&A right here too. Several questions were posed during the session. All right. There's one question posed about a research study that talked about medication adherence. I think I know what study you're talking about, and I will follow up with this person after the session. Second question directed toward Dr. Quinn. Of course, every patient is different, and we can't give blanket advice, but one of the questions was, are you allowed to take hormone blockers if birth control doesn't work for heavy periods?
I think by hormone blockers, probably talking about more like stronger hormone blockers, something like Lupron or things that really like shut down the hormonal axis We use them sometimes in patients that are transitioning genders, for example, to just like shut down one hormonal axis and before we ramp up another one. In terms of period control, if things are really painful, really heavy, and they definitely have been used, they are also not used lightly just because the side effects can be like pretty intense. But I guess to most directly answer your question, yes. And if you feel like, birth control hasn't worked in that way to help control periods, definitely getting an appointment with one of us or an OBGYN would be great, I think, because you would be able to really make sure you've checked all your other options that wouldn't be as like intense in terms of treatment before moving on to something like that.
Right on. So on that same note, I know you provided the adolescent medicine phone number there. Is that the best way to connect with you and make appointments, or should a referral go through the transplant team? How does that work?
Both of those are totally fine. The number there would give you the broadest entry point. So you would be able to schedule with any one particular person that, like, say you were just interested in like the eating disorder clinic or like the gender and sexuality clinic or something like that. You could, sort of get the whole menu of options there. Or if you feel comfortable telling your transplant team, specifically like what you were interested in seeing us for, then you could always have your provider contact us as well. But both of those are totally reasonable ways to get through.
Great. And one other question was about, these can be difficult topics to talk about with your child. And you had that great resource called parentandteen.com. I'm going to send those resources out to the attendees after this. I'm going to email it out to everyone. So thank you for including that in your talk. And then for Jen, there was one question about insurance information. I see I will follow up with this person after to get more information about what the insurance question is. So stay tuned for that, attendee. Jen, I really appreciated a lot of your talk about talking about adherence, how it's not punitive, not punishment. It's about transparency, honesty, and collaboration with your care team. So we can find out what's going on and we can help you the best we can. I thought that was a resounding theme throughout your presentation. I appreciated that. Do you want to expand on that a little bit too for our last couple minutes?
Definitely. So, and I think Dr. Quinn also expanded on it a bit as well. It's all about open, honest communication with us, that we are here to help. We are here to assist you. And we know that this is hard. We know that day in and day out doing the same thing can be difficult. So we always ask that you reach out to us because we will help work with you. We will help find solutions, even if it seems like a monumental problem or a monumental task to overcome. We will work with you to find solutions to help you and help you get through this. And these things can even mean sometimes not only just adjusting your medicine schedule around, it may be adjusting your medicines. Maybe we have once daily options. Maybe we have options for doing other types of medicines where we can really streamline and work around you and work around your changing life as you're growing up and you're moving on to other areas that are certainly exciting, but we're certainly here for you. So that transparency and communication is really key so that we can help you out along the way.
Absolutely. Well, we're at the 6 o'clock hour. So thank you so much for Dr. Quinn and Jennifer for your expertise and your time. Thank you for all the attendees that joined and the great participation in the Q&A. I will be sending out some of the resources that were talked about today, a link to a survey, and addressing some of these specific questions that weren't talked about here. All right. Thanks, everyone, and have a great evening.
Bye-bye.